Vanakkam and welcome to Suvai, folks. RJ Sudha here, founder and anchor of Suvai Radio. Happy New Year wishes to all of you. Happy New Year would mean starting off the New Year with, New Year vows about keeping yourself healthy and most importantly, keeping your heart healthy. And along the same lines, we have with us in the studios Dr. Naras Bhat and a very upcoming and bright doctor from UC San Diego School of Medicine. About Dr. Bhatt has been in our studios as part of Tamil Suvai Radio and the Radio Matri studios, has been with a couple of times already, but to recap about his accomplishments, he is a leading board certified doctor in internal medicine, obesity medicine, and sleep medicine, metabolic cardiology, allergy, and immunology. And he's here to explain to us about inflammatory markers and ideal diet to adopt and the right heart healthy exercises. And about Gautham, he's a medical school, and during his medical school, he completed a Fulbright grant in Brazil and a master's in public health at Harvard. He has research interests including global health and cardiometabolic disease prevention through diet, exercise, and lifestyle modification. And you can see how these two doctors are merging towards having a common interest together. And he has conducted several global health projects in Brazil, East Africa, and India, and has published several peer-reviewed articles on diabetes and cardiovascular disease prevention. He has presented his research at local and national meetings, including an award-winning oral presentation at St. Jude's National Symposium at Memphis, Tennessee. In his free time, Gautham enjoys cycling, hiking, and plays a host of musical instruments that is evident from his backdrop. Anyway, and coming back to Dr. Naras Bhatt's background, um, he has he has received he's an author of several internationally renowned books. For example, How to Reverse and Prevent Heart Disease and Cancer, Reversing Stress and Burnout. Tell me about it. This is just the need of the hour at this time. And he's also written a course book for UC Berkeley students, Unlearning Test Anxiety and Stress. I wish I had known about it while I was a student. And produced two popular videos, Uprooting Anger and Meditation Prescription. In 2002, Dr. Bhatt was the president of the Biofeedback Society of California and a board member of the Applied Psychophysiology and Biofeedback. Dr. Bhatt's work citation included in Time Magazine, Cardiology Today, Business Week, and National TV, and much more. Welcome to the show, doctors. How are you doing? And very happy New Year to both of you, and happy and healthy New Year to both of you, I should say.
Thank you, Sudha. We are very happy to be here and share some of the concepts, which is very innovative and cutting edge and updated as of 2024.
Great, fantastic. Let's get started. Let's jump deep into two case studies. Number one case study is the late Kannada actor Punit Rajkumar, who passed away October 21st of 2 years back, I believe, and due to sudden heart attack. And he had perfect conditions. He was a hero, worshipped by so many in the film industry as a mass hero. And Dr. Naras Bhat was contacted by Deccan Herald and Bangalore about it. And Dr. Naras Bhat, what do you have to say about his health conditions, considering that he had a perfect chit on his health?
Well, Punit Rajkumar, the well-known Kannada actor, he passed away actually in year 2021. It was the month of October. And then he was only 46-year-old. And such an eminent man received the best care and the best standard of care, I would say. But then what is the flaw is what everybody wondered. And that's why Deccan Herald called me to ask, what do you think might have been missed? And obviously, such an eminent man, some of the information is hidden, like his real cholesterol value and everything else. His heart scan was normal, it was told. But what we didn't know, what we don't know is his LP(a), the number one killer for people of Indian origin, wherever they live in the world. And that was not tested. And then inflammation markers, as we look at cardiac events, Today in 2023, now 24, the inflammation markers were not tracked. And in fact, in 2021, when he passed away, it was not a standard of care. In 24, it is a standard of care. And that is our discussion today.
Great. That's very sad to know, if considering that he had access to complete medical system. It is indeed sad that there was not enough knowledge in the medical system in India, or he did not, I don't know, whether the hospitals that he went to did not provide him that knowledge and the education. That is sad that we could have saved his life. Dr. Gautham, upcoming Dr. Gautham, had recently come across another patient. Luckily, that patient survived in spite of having back-to-back cardiac arrest. Dr. Gautham, could you shed light on that specific patient's history, and how he was treated and how he's doing now?
Yeah, so this is a 60-year-old male. Previously, no medical conditions, no diabetes, no high blood pressure. Cholesterol was fine, so on and so forth. Doesn't take any medications. He presented, so he was at home, and then at 7 a.m. one morning, he felt just a massive pain in his chest. His wife called 911 and the paramedics came. They put the EKG leads on him, which immediately showed a STEMI. His previous EKGs were normal. And they rushed him to the nearest emergency room. At the emergency room, obviously the cardiologist is there, is notifying him, hey, you just had a cardiac arrest, or you just had a heart attack. And in that moment, he goes into his first cardiac arrest. And so right there, they have to defibrillate him and resuscitate him. And they immediately take him for an emergency stent placement, or a percutaneous coronary intervention is what we say. And during the stenting procedure, they find 2 blocks in the large artery of your heart, known as the left anterior descending artery. And they are able to stent both of those blockages open. They were 99% closed. But during the procedure, he has 3 instances of ventricular fibrillation, which is one of the heart rhythms where the heart is no longer able to pump blood. And so he has to be defibrillated and resuscitated again during the procedure 3 times. During the procedure, they also found his right coronary artery to be 90% blocked, but they did not stent that open because it was not what caused his heart attack. Thankfully, thereafter, he comes out into the ICU, takes a few days to recover, has a few complications due to some of the things that happened over that time, including low sodium, low albumin in his blood. But within a week, all of those things have rectified, and he was discharged home on a myriad of medications 1 week later.
That's wonderful news. Dr. Bhat, what is your stand on this particular patient stand?
As I heard from Dr. Gautham here, he had normal cholesterol, and his doctors did not put him on a cholesterol lowering medication. This is a number 1 myth, number 1 flaw in our system. I'll explain why.
Yeah, that was going to be my first question to you.
Wonderful.
What are the common myths about heart ailments and heart conditions?
There are 2 top myths that are, if we focus on that, we can save a lot of lives. The number 1 myth is believing that the cholesterol is the fortune teller. Cholesterol is not the fortune teller, and because there are other factors, specifically the LDL cholesterol, people think when it is not more than 100 or even not more than 130 in that range, then you are safe. The answer is 50% of people who get admitted to the hospital with a heart attack have normal cholesterol, period. Why? Because it is not the total cholesterol. If you're focusing on cholesterol, it is the cholesterol particle number that is responsible for continued atherosclerosis and inflammation. For that reason, when we talk about cholesterol, one should focus on LDL particle number, which should be below 700, or a surrogatory marker called ApoB. So worldwide, people do the test for ApoB. LDL particle number, I believe, is mostly available in the US and Western countries, may not be in India. And by the way, I am trained, I did my MBBS training in India, but I have been practicing in the United States for the last 50 plus years. So that's why I don't know the current way they practice in India. So number one myth is cholesterol, and cholesterol, we should refocus on the cholesterol particle number. Second part of the cholesterol myth is LP little a. 25%, perhaps 30% of people of Indian origin, we know that we call as South Asians in this place, in the United States. You know, sometimes we have the parlance called Desi people. That is whether you are in India, Pakistan, Sri Lanka, Trinidad, or anywhere, we call it the Indian diaspora, have LP little a as a major and malignant coronary artery risk marker. Everybody should be tested. So Dr. Gautham, did this patient have a LDL particle number test or LP little a test?
No, I think the screening that was done for this patient was cholesterol in the lipid panel annually, and then blood pressure annually. I think what we usually learn in medical school, and I'm glad that you're adding these other biomarkers that are important to look at. What we usually look at is like, what is the 10-year risk of a patient for developing cardiovascular disease, and I think the calculation is like you need to know their age, their gender, and then these other general things that we normally hear about, such as diabetes, smoking, total cholesterol, blood pressure, and then their race, and that usually spits out their risk. But for this patient and most of the patients that I've interacted with, there was no LPA nor ApoB biomarkers done.
Very good point, Dr. Gautham. Let me elaborate on the 10-year risk issue. As we sit here in 2024, the 10-year risk calculator is a back burner. A busy doctor like me who is talking to patient, I don't have time to do all this math of 10-year risk. And additionally, the new way to look at risk is LDL exposure years. You have heard the pack years of smoking. How many, if you smoke 1 pack per day, how many years of such 1 pack year you have been exposed to tobacco? Similarly, the number of years of exposure to the abnormal LDL is the one that creates the problem. And that brings us to the real myth, and that is the coronary artery disease or cardiovascular disease or a cerebrovascular disease or peripheral vascular disease is a plaque disease. The plaque is built, it grows, and it ruptures by plaque rupture and creates a clot that causes what is called MACE, major cardiovascular event, which is either a heart attack or a brain attack called stroke, or the third is the death by either one of the cause. That is called MACE.
So you're telling me that the plaque disease is the root cause for either of them?
Yes. Atherosclerosis, including hypertension, is a plaque disease. And the plaque is created by inflammation, it progresses by inflammation, and it ruptures by inflammation. That is why the plaque is the focus.
Or actually, in that case, we have to make one step backward and say inflammation is the root cause for everything.
Absolutely true. Absolutely
Okay.
true.
Okay.
And that is why let's discuss a little more about the inflammation.
Okay.
And then one of the things that we would always want to remember, Dr. Gautham, you're a very young doctor just coming out of training. 2023, just 2 months ago, the cardiovascular authorities like American Association of Cardiology, College of Cardiology, Diabetology, and everybody have created a new disease, coined it as a CKM syndrome, that the cardiovascular, kidney, and metabolic. And that is now we look at all these three things, CKM together. That is why we need to look at hemoglobin A1C or the high triglyceride, which or abdominal obesity, and which is a part of the metabolic syndrome. So having said all of these, any one of us, or like your patient, number one thing to do is, besides doing your cholesterol panel, which is most doctors do a heart scan to look at the coronary artery calcium score. Heart scan is like a pregnancy test, yes or no. If there is calcium by your heart scan test, you have coronary artery disease, period. This confirms to the patient and to the doctor that this patient has a coronary artery disease. And the calcium score higher means more of the presence of plaque disease. Once you have done that, most doctors, what they do as a standard of care is, oh, do you feel any shortness of breath? Or let's do a stress test for heart. The stress test for heart only tells you how much blockage is there. It does not tell you if you are going to have an impending cardiac event, heart attack, or stroke. Why? Because the stress test only looks at the mechanical blockage, the degree of the blockage of the tube of your coronary artery, does not tell how likely you're going to have a breakable plaque, which we call as the vulnerable plaque. If so, let me tell you, Sudha and Gautham, are there markers that will tell you? The way I teach my patients and my students is, it is like a volcano that ruptures. The hot lava builds up inside the volcano and then it ruptures. So there are markers in your blood that tell us how hot the lava is and how likely it is to go into rupture. Shall I list them very quickly for your audience?
Sure.
Okay. And number one is
Let me go back one step. When you say the lava, are you equating the lava to be the plaque?
Yeah, plaque and inflammation inside the plaque.
Okay, got it. Okay.
Very good. I'm glad you asked that question.
Yeah,
because it is very
before
clear.
we go further, I wanted to make sure that I understand, and the viewers also
And
understand.
that inflammation is traceable by blood test.
As simple as that.
As simple as that.
Okay.
And what are those blood tests that trace that information?
Okay.
The number one is called HSCRP, highly sensitive C-reactive protein. That test is available all over the world, in the US, in India, in the Europe, anywhere. And it has become now almost the standard of care, particularly so, which I know we are going to talk about it later, particularly so now because we have a medication called colchicine to counteract and reduce inflammation, which we'll discuss later. But right now, let me tell you the other markers. There are top three. There are many, but top three are. One is HSCRP, second is LPPLA2, and the third is myeloperoxidase or MPO. If these three markers are up, red flag, that means there is a high chance within the next few months that person will have a major cardiac event or a stroke. And this, we have specialized lab in this country, which is called Cleveland Heart Lab. And then the regular blood test lab called Quest Diagnostics will draw your blood and send it to Cleveland Heart Lab to test these other two, myeloperoxidase and LPPLA2. HSCRP is such a garden variety test that any lab anywhere can do it. Okay? So
the three
we
things that you
covered the
mentioned,
marker.
Doctor, HSCRP, LPA2, MPO, is it
MPO.
taken or all of them?
I would do all of them.
All of them. Okay.
Because I would do all three of them. And if any one of them, I'm glad you asked, if any one of them is abnormal, I do the intervention, which we are going to discuss later, anti-inflammatory diet, exercise, and even medication. Then I track it every 6 months. That is how you prevent the catastrophe. You prevent the next cardiac event for this 59-year-old patient that you just mentioned.
Are these tests usually covered by insurance, Dr. Bhat?
Excellent question. Are these tests covered by insurance in California or in the United States? Answer is definite yes.
Okay. And then what is the utility of these tests once a cardiac event has happened? So there's going to be, a lot of inflammation already.
Very good question, because once the person had a cardiac event, the plaque is still there. And the plaque can again accumulate hot lava, and the plaque can again rupture and again have a clot. And that is why you need to monitor it.
Does placing stents or doing any other sort of, like a cabbage, for example, will that transiently increase the inflammation and show up as a false positive? Or is it something that you should still track with these biomarkers?
Very good question. Yes. And when you do cause any injury to any blood vessel, these markers will go up temporarily. As you know, any injury heals. How long does it take when you have a cut? 7 days or 10 days. So after that, everything cools down. So you can retest it, give it some more time, a month later, and then start tracking it again. For this patient, LP(a) should be tested. His son or his children should be tested as well, because LP(a) is a hereditary risk factor. That is why your listeners who are listening, they should think, get the LP(a) tested. If one person in the family is positive, test anybody else blood relative in the family. Why? Because it's a malignant coronary artery disease. It is rapidly progressive. You control it by controlling all other risk factors. And as of now, we don't have a specific medication for LP(a), although something is forthcoming in the next couple of years.
Very good discussion. Thank you.
So we have covered the inflammation concept. Okay. Now, should we go into what is the treatment if you have these high inflammation markers? Most people who leave it at that, hey, you had the heart attack and your cholesterol should be normal, and people treat you with a very high dose of statin, and then they bring it down by the rule of 7. That is, you want the LDL below 70, if possible, HDL up towards 70, and triglyceride down towards 70, and then if you do measure the LDL particle number, it is 700 or less. That is the cholesterol goal. What about the inflammation goal? That is what my specialty is. By the way, as an immunologist and a metabolic cardiologist, I focus on the inflammation, with the magnifying glass looking at those tests, okay, if you will. And so what is the treatment? The treatment is first, we call it prescription and proscription.
Oh.
What not to do and what to do. So let me first enlist the 7 components of an anti-inflammatory lifestyle. Okay? For your listeners, let me enumerate it so that they could make notes. Number 1 is the anti-inflammatory diet and supplements. Number 2 is intermittent fasting, because eating has 2 components: what to eat and when to eat, and the parenthesis, when not to eat. So those are the first 2, and I will elaborate on it if time permits later. And the number 3 is the non-sitting. Sitting is just like smoking, is a major inflammation producing factor for coronary artery disease. Non-sitting means standing whenever possible. Typically 3 situations: when you watch television, when you use your computer, when you use your phone. And these 3 situations, if you stand, you have it covered to reduce your inflammation. The antidote for sitting is a non-sitting, which is called NEAT. NEAT refers to non-exercise activity thermogenesis. That means moving your body like a child who does not sit idle, keeps on moving the body. And then additionally, we recommend core exercises. So core is your abdomen, how to engage and spot the engagement of your abdominal bracing. Isometric contraction of your core muscle itself is an invisible NEAT exercise. Example, right now I am standing and doing this Zoom meeting. I just lift one leg up as a one leg standing. That itself is the additional core engagement and additional NEAT exercise. Wherever, if you sit in the sofa or the chair, lift up your feet up above the floor, and that itself engages your abdomen, your core muscle, and that itself is a NEAT exercise. So you can do it anytime and anywhere, and there is no excuse. You have to be mindful, that is the point. Now moving on to the item number 4 in the 7 components of anti-inflammatory lifestyle, abdominal obesity reduction is the key. Abdominal obesity reduction, abdominal fat accumulation is not only pro-inflammatory, inflammatory cytokine, IL-6. Dr. Gautham, you must have read about IL-6, and then all, during COVID, we have used a lot of IL-6 testing and so on and so forth. So the inflammatory markers, these are released from the fat cells in your abdomen, the visceral fat cell. And by the way, Asian Indians, we from India, we have a higher incidence of abdominal obesity, and then that itself is a risk factor. That's item 4. Item 5 is good night's sleep, especially sleep apnea or fragmented sleep or insomnia of any kind. Most importantly, the circadian rhythm, the software engineers who work depending on the world clock, disrespecting the sunrise and sunset in their own home, and that is a major risk factor for inflammation And one night's lack of sleep alone increases your HSCRP and inflammation markers. And if you are vulnerable, one night's of sleep loss can give you a heart attack the next day. And now, moving further, item number six is stress and anger. And anger, if somebody is very angry, had a very anger attack, what sometimes people say, if the wife tells the husband, you know, you're very angry, why don't you go for a run? If you send your husband for a run when he's angry, he may not come back, because the anger increases your chance of having a heart attack 2.5 times. 2.5 times. So what is the best you can do when somebody had an anger attack? The Shavasana. Lie down, close your eyes, focus your awareness to the rest of the body, one part at a time, because human aggression is the least in the lying down position, and that protects your heart as well. Isn't that very interesting? Okay.
Should we, doctor, start a second session, because this first session is ending in 5 minutes?
Sure. And second, the last item is the habits. So I have like smoking and alcohol. So just to finish this part of the session, let me restate the 7 components one by one. Number 1, anti-inflammatory diet. Number 2, intermittent fasting. Number 3, non-sitting. And number 4, abdominal obesity reduction. Number 5, good night sleep. Number 6, stress and anger control. Number 7, controlling bad habits like smoking and alcohol. And now, with that note, then we can go to the part 2 if you want to disconnect and reconnect.
Yeah.
Okay, let's do that.